Welcome, everyone, to our Innovaccer RCM podcast. I'm excited to introduce everyone to Jeff Spight. He's a recent addition to the Innovaccer team. So, Jeff, welcome to the Innovaccer RCM podcast. Why don't you give our audience a little background about yourself?
Thanks, Patrick. I appreciate that. I spent most of my career in healthcare, other than a little small sabbatical doing investment banking, and realized I wasn't a banker. So I've got to be on the payer side, the provider side. I've done government work. I've done commercial work. So we've been in all angles of this, and it all ends up tying usually back to how do you get paid. So this is a good conversation to have, is to get in on an RCM podcast.
Fantastic. Yes, folks have been trying to focus on getting paid in healthcare for a long time. What I'd like to bring our audience in on a conversation between us is AI and healthcare revenue cycle management. So, before we dive too deep into all of that, give me the broad takes of what you're thinking about AI and how it can be applied in the healthcare RCM space.
Yeah, so it's probably the first place that everybody thinks about where AI could be really applicable, right? These are pretty standardized, scoped out, specified processes, steps to go through. They have lots of detail in them. You check off these boxes, you get these codes entered, you send it off. This is a perfect place where usually can make a really good investment case about why you'd want to get in on this. Um, and because if it's not done well, it hangs up and it creates a lot of extra work down the road, right? Uh, I think the part that gets super interesting though is when you do this. This is not about just getting paperwork done. It's not about just clearing the basics and figuring out how to get through it. There's multiple aspects of this, and I think when people think about RCM, maybe they don't really define it as widely as they could. And I think, unfortunately, then what you end up getting is they fix a little problem here, they fix a little problem there, then they start stacking all the little fixes they got everywhere, but they don't stack well. And then we end up kind of where we are. We're in a big mess of stacked little, solutions that don't actually solve anything. So, this is now a chance for us to really think about what does it take? What do you have to really set up to make this work?
Makes a lot of sense, and it's very interesting because I like to think or like to say the rails of RCM really haven't changed and since that's the dawn of a payer-provider relationship, right? There's a set of
Uh,
policies that you've got to follow. There's documentation associated with medical procedures, and at the end of the day, the details of each of those just continue to expand and at least today, really rely on a lot of humans in the loop, people in the loop to get this job done. So, when I think about stepping back though, and how you introduced us there, um, why don't we get your sort of definition of revenue cycle, and do we need to think about redefining it from this classic payer provider, follow these policies, apply lots of people to it?
Yeah, look, what I love is whenever I've been in these provider organizations and I run them and we've got an RCM team, I in my head I have this like there's this little notion of this group that we keep in the basement and we slide pizzas under there and then they're just supposed to make sure the claims get submitted and we get paid, right? And you just think it's going to work that way and they just, stay down there and keep plugging away. The truth is, if you think about RCM and making it work really well, it's not just about getting that last claim put together and getting the submission out to the clearinghouse and figure out how you get paid. It starts from the minute that the patient walks through the door, even possibly before, right? We have to think about all these things that we need to collect about the individual. We've got to be comprehensive about it. We need to know all the things that trigger out where they would then flow as you go through the process, right? So I like to think that RCM starts the minute that we first get in touch with or we interact with the patient. And there's all these sets of activities about just getting that set up. There's even components too. I've been in health plan side for so long too, where we try to define so well, like this is exactly how you're supposed to submit. And when you think about even getting prior authorizations or pre-approvals or step function things that we look at, we come up with these what we think are really detailed, uh, you know, uh, recipes and protocols and processes. But there's tons of little gray area. And even from most health plan operators where they're running claims, you see they're not really sure what's going to happen when you put in things, and we got to see if it hits, snags, kicks back. Does it's going to flow through or not? Because there are little gremlins in the system, and we haven't defined every possible permutation of every step in every way. And what ends up happening in the old days is you'd get a few people who would just learn by repetition that, hey, if I do this, it gets through. And if I don't do this, it doesn't get through. Right. And so what we're trying to figure out is there a better way to go through this than other than massive repetition and have individuals start to read tea leaves and know that, if I capitalize my I here and I put a space and that it goes through, or if I use this code with this payer on a Tuesday and the moon is waxing phase, we can make that happen. The great thing about AI is it can learn all of that and rapidly get to a place where it discerns some of those patterns that define or specify the undefined, right? And so I think there's some real possibilities about it. But unfortunately, what we end up doing is I go back to that first point. We start to figure out, okay, well, we run, and then we get into trouble, and then we go fix where that trouble is. And then we go build a solution because somebody has a solution to fix that. And then we keep running and we trip again, and we're like, what's this? And then we go find somebody to fix that one. And unfortunately, it engages every aspect of your organization. It can impact the people who are doing the intake on the patient on the very front end and getting their eligibility and understanding what plan they are and what their copays and co-insurances and coverage and whatnot. And then, you've got the group that's actually delivering the care, and they've got notes to write, and they have to put codes in a certain way, and they can only put certain codes in certain ways. So now you're talking to the clinical team, and then you're talking to the scheduling team, and then you're talking, and unfortunately, this ends up touching virtually every corner and every nook and cranny of your organization to make it run well. When I have seen it done great, it is done with a very comprehensive picture about all of the touch points that an organization has in pushing through the work that needs to get through, right? And once you've touched all that, you get to a stabilization point, and then it's about learning, right? Then it's, okay, what are the other things? Where are we seeing there's new problems? Because unfortunately, these things, even if you think you solved it day 1 or day 6 or day 20, day 25, that we changed the rules, we changed the setup, we added a new thing, and so it's constantly trying to stay on top of, what are those things? And then it's about building a radar for yourself, a capability to understand when do we think these problems are coming, and how does then the organization react, and where's the best place to react? Is it at the front desk? Is it in the exam room? Is it afterward when we're reviewing the coding? Or is it even after when we're dealing with, the denials and the appeals and whatnot? So, I think we need to think about that. And so, and as you lift that, we've had previous conversations about, well, then who in the organization needs to be involved? And how do we think about that?
You said some real interesting things here, Jeff, and I want to build up towards some of these solutions and really discuss how AI can help. But one of the things I wrote down is that there's got to be a better way. And one of the things that maybe at the end of the day, the easiest scorecard to look at, that I tend to look at, especially being in healthcare technology, we've both been in this a long time, is no matter what has been thrown at it, from software, from all the money invested in EHRs, from some of the point solutions folks are using today, the industry still reports that 10 to 12% denial patterns. Like, we've spent millions and millions of dollars trying to drive that down, and the results continue to say, maybe you spoke to some of this, the changing patterns, but at the end of the day, 10 to 12% is the scorecard that everyone seems to be managing up against.
Yeah, and here's what I think is really interesting. So I think about just a normal practice that let's just throw out some typical numbers, right? Practice is going to see 40 patients in a day as an example. And so they got 40 claims and setups that they're trying to push through. And I think you got to really break it up into two buckets. I think there's 90% of that, or let's say 36, that if you're doing RCM really well, you really don't have to touch it a whole lot. It should just stream through and you get paid. That, like, these are well defined, they are common, they happen all the time, the setup isn't very complicated. And so your ability to be able to process that without ever having to manually manipulate or do a whole lot of things is honestly table stakes at the end of the day. If you're not doing that, you're not running a well-run RCM shop, right? Now, so you think about that 10 to 12%, but the other problem is the 4. And the 4 usually, unfortunately, this is like where they tend to come in. They're complicated. They're usually a lot of money. They have a lot of things that plans want to try to do that differently because, well, guess what? These are the things that actually really do matter. You know, I believe that over time, we're going to have this like AI arms race to a degree between the payers and the providers. And we're going to work through this 90% thing. We're going to get the 36 solved. But the 4, yeah, I'm going to just tell you right now, I don't ever see that changing because there's just, that's where the real conflict is. That's where the tension is in the system, and it's built that way on purpose. And if you solve the first 4, they're going to find another 4 because I guarantee they have another 4 somewhere else, right? Like there's a long list of 4s to go find. And so then as a provider system, when you're trying to do the RCM, it is about understanding when you see that, you know, how to tackle the first 4 and then how do you deal with the shift? How can you forecast it? How can you react quicker so that you don't create it where you're doing 4 a day and all of a sudden in 3 months, you now have 300 really high cost, high valuable claims you need to process, and they're sitting in a really difficult work bucket, right? And that's a challenge. You got to be staying on top of this, or this thing will pile up and become a real mountain for you to climb.
It's very interesting because number one, as you point out, is humans in the loop are always going to be required. We're talking about healthcare. The thought process that this can be 100% automated is just, I think, a fallacy or a false assumption to begin with, right? But it's about being prepared and staffed and ready for the focus that it takes, especially on those high dollar claims. So let's break that down a little bit. The first side of this is how do you get the noise out of the system? And there is that, let's say 90% that should just flow through the system. There's always this talk track that you can't apply AI to bad process. You
Oh,
can apply AI to well-documented process, and that's sort of a step one.
so I was listening to an interview of Elon Musk the other day, right? And I appreciate he has his fans and his not so fans, right? But he brought up something interesting. He's an engineer by nature, right? And he said, you know, the first thing is you figure out what you're supposed to do, and the next thing then is you figure out how do you optimize it. He goes, but too often we jump to optimizing before we figure out what we're supposed to do. So then we spend all this time and effort and energy and brain power and resources to optimize what we shouldn't be doing. And unfortunately, I think that this is what we end up doing a lot of the times in healthcare, and we definitely do it in RCM, where we optimize a really bad process. We optimize a process that we don't need to solve. And we build this beautiful solution that fixes the thing that's not really the problem. And so that's why that's again, we got to step back and we got to think about what is the larger solution here. And I do think it's important to think about, is this the 90% that we're not supposed to touch? And how can I make it so we don't have to touch it, right? Or is this the 10% that we know we're going to touch, but then let's leverage who's touching it. Let's make sure we're getting the most out of it. Because truthfully, most of the time that 10% is the most expensive people, right? It is on both sides. That 10% is not being handled by a low-level claim adjudicator. There's probably a nurse on the other side of that deal. And that's probably going to go see a doctor on the other side of the deal, right? And so there's, and on the provider side, those are the ones where, the practice manager's probably getting involved. You've probably got other executives, other people, and then you're going to bring in the contracting people. You're going to bring in this thing can get bigger and more involved in it. And in, a lot of times it becomes negotiations in of themselves, right? So you need to be armed with all the information. You need to know all the things. You need to have the context so that you can go have those, say, friendly, collaborative, cooperative conversations with the other side of the deal, right? And I've been on both sides, so I get the game. But one of the things that we can do as we work through setting these things up is making sure that the people that we are engaging in this, they're not being wasted. Their time's not being wasted, right? And so I often think a lot about the process as you go through it. And I'm like, well, who's having to touch this? Am I having to have my higher end? Is my doc actually spending time going through coding and trying to fix the code to see if it goes through? Or who's on the phone with, who's managing this? Do I have to have a practice manager being involved, or can I do this a different way? And I think one of the places where AI can do a lot is you leverage your most valuable resource in the best possible way, so they're not doing a bunch of stuff they don't need to do, right? And when we set up RCM really well, our broader team can handle more of the stuff because they step up in skill capability, right? And AI and the right platform, the right setup does that. It skills everybody up.
You said again some very interesting things here, and even tying it to how we opened this conversation of RCM starts when folks walk in the door, maybe even when they're searching for care. You also talked about how context and that data is so important, and so these are the pillars by which it allows our RCM professionals to operate at the top of their value curve, right? So, give us some examples of ways to sort of shift left, bring that information in earlier on, and how it can contribute to a well-run RCM machine that drives meaningful ROI for an organization.
So, we talked about this earlier before we even engaged on this one when we were kind of scoping out the idea. And I think this is a super important one. It's about, where do you start, right? Like, at what level in your organization are you starting this with? And far often I see organizations where we give, and I mean this well in all the right ways, but we give some mid-level manager, a director, responsibility to fix this. But they don't have the purview and the relationships and what I would say is the ability to impact the larger organization. So they are really good at dealing with the 6 people who are going to enter in the information and get it off to a claims, but they don't have the ability to tell the front desk staff that you need to change what you're doing, or we need to change the process with the steps. And so as such, I tend to say a lot of times we under level the who needs to champion and who needs to run the project, right? And so in something as important as RCM work, or getting revenue through the door for all the work that we're doing, I often tell you it needs, you're not worse off if you over assign that, right? And in my mind, that's usually you start with either a COO or a CFO, because at that level, then there can be conversations that go across all the different places in the organization that have to touch this thing over time. And when you don't do that, you miss your opportunities to make sure that everybody's aligned and the process is fully defined, right? So I would say that's kind of like one of the first things I see when you're trying to do this, where people don't do it right. The second thing that I think is super important is that we have to make sure we understand the complete process. So, and when I say that, I do mean, hey, from before even the patient came through, what are all the things that we need to know? And if you're going to have a fully cool touchless process where I'm going to go through everything, here's all the places where it can fail. And then how do we build a process so that it prevents that failure from happening? I don't think you'll ever get to 100%, right? Because it's just things you shift and move and somebody forgets something or whatnot, or the patient changes their insurance in the middle of the processing time or something along those lines can all happen. But one of the things is if we've not detailed work through every step and said, okay, hey, clinical team, I need you to get your notes in this way, right? And if you're going to use AI scribing, well, how are we going to scrub this? I just did for our big Innovaccer context, sessions that we had. I got to be a part of a session to talk about AI scribing, and and it's interesting because we talked about how it frees up time and does all this great stuff for providers and whatnot. But like one of the key components of AI scribing is actually to support RCM work. I mean, that's usually the driver of why you even did it. That and the providers are complaining about how much keyboard time they got to do, right? But what's interesting then is AI it's powerful because it can listen to the conversation and it can put all this stuff in, but it can also create a bunch of stuff that you don't necessarily want into the thing. And I call it note bloating. It'll find something that you're like, that's not actually a code I would have entered in had I been listening to that conversation and I thought that was appropriate. It can do great things because it can surface things that we didn't necessarily hear. And if you hear half of a comment from a patient that they may have trouble paying or they're not sure how they're going to get to their appointment, it can kick in other resources to help that patient. That's the plus side of it. But it can also hear something that says, hey, I may have a pre-existing condition because I've been coughing for 4 years. Well, that's not, we got to be really careful about how we do that. And if we've overdone it or overturned, what I would say is turned over the thing to the AI and the machines to do everything, we've lost our ability to provide judgment and to say, hey, this is what really should go through the screen. I'll go back to it. This is why you need that C-level suite person, because they've got to go be able to have a conversation with the chief medical officer and the chief clinical officer. And we got to have a conversation about, hey, so this is everything that we found. How do we help you narrow down so that the notes are comprehensive but not overly bloated, that they don't have things that we don't mean to be billing for? How do we feel very secure and good about all the things going through? Now, a lot of people don't think that's an RCM responsibility, but I'm going to tell you that's probably the place where it sits, because we are gathering all this information. We are figuring out how it goes in. And RCM's job, I will say, is primarily figuring out how to get paid. But for me, they are the gatekeepers of that valuable gold transactional data and clinical data that ends up in the back end of the system. And that keys off everything we might do with that patient between visits for the next visit, right? And so when you start to put all of those pieces together, you realize that it's not just about getting paid. This is about owning the data, the accuracy of it, owning that it's appropriate, owning that it's right, owning that we've eliminated what could be wrong, right? So in my mind, that is their job, is to be that gatekeeper of all things that we create out of all of our interactions with our patients.
So Jeff, I want to highlight, because for me this is a hot take, right? And it's
Yeah.
to really zero in on two things you said and sort of even compare it to just how the industry is moving today and how we see a lot of organizations structured. But you, of course, it's sponsor at the right level with a view of the complete process and sort of that ownership of all of the data, right?
Yeah.
When I compare it to how organizations are structured today, how budget cycles in healthcare organizations are done, you typically are at more of a mid-level, I have a problem to solve for coding, or I've got a
Yeah.
denial problem, or I've got a prior auth issue. And what can happen is folks can ultimately try to find point solutions that then leave an organization stitching together AI from multiple vendors
Yeah.
and thinking somehow they're going to come out the other side with an improvement on that 10 to 12% that really needs our attention. And now I'm left stitching this data together. So really, this is a hot take you've got to get people thinking about this, solving this problem from a different lens.
Well, the other thing, at Patrick, I just was thinking about this as he brought this up, and when I've been in the rooms, and I jammed in myself into the basement and brought the pizzas down for the team. I also think about how do they prioritize what work they do, right? Because there's tons of claims every day. We're creating more and whatnot, and so, and my visualization is there's these little mountains of piles of paperwork that we keep everywhere, and sometimes we divide it by payer. Like here's all my Blue Cross claims, here's my United claims, here's my Cigna claims, and or it's by which here's my Medicaid ones, here's ones that are older, here's the ones that are that are about to time out, here's the ones that are hanging up because there's no prior auth, and we create these like little piles, and we assign people piles, and I've even heard them go, you do it by you start on the Z's and I'll start on the A's, and we figure out when do we meet in the middle, right? And I'm like, we have to be more sophisticated in how we approach this, right? And the right systems are going to channel the work in the right sequence, in a prioritized sequence, a prioritized order, and get it to the people that it makes the most sense to get to. I mean, I appreciate that. And so this gets into, if the system is running really well, it is skill-based routing every one of these things, right? And you're getting that very new one that you just hired, and you're getting them through that 90% basics. Let's get you into the process. Let's understand what you're going to do. And then there's going to be like, oh yeah, here's all the ones that these are going to take phone calls and negotiating, and we may have to call the contract in person. And, that's this other pile. Now, I appreciate everybody needs a balance and working through those things, but even just prioritizing how we do the work, right? There's so much more that can be done, and in a really great AI system, you're not thinking about creating which pile. It is absolutely figured out. Hey, the next one to go work on is this, right? And it can do those things. So I was thinking about your comment about that, and I'm just sitting there going, oh my gosh, how many times did we sit there and go, yeah, I'm now I'm on Brown, and which one are you on? I'm still on Thomas, and okay, well, we'll meet somewhere in the middle. And I'm like, this cannot be the way we're managing it, right?
I've made it through the letter T.
Yes,
It's
yes,
all working down the
exactly.
path.
Like
So
there's a big phone book out there of claims,
that's
right?
right. It's interesting to compare it to the phone book, right? Because we've really advanced so much, but at the end of the day, there's so much data in healthcare. And if you're not relying and leveraging AI for its ability to take all this data in and make meaningful uh, uh, sense of it all, right? To help do things like prioritize, to help ensure skill-based routing. But really, Jeff, at the end of the day, what you're talking about is RCM transformation. If
Yes.
you approach this at the wrong level, solving point problems of I can only make it through the letter J in a day, you're missing the bigger picture and the opportunity of what AI can do, and you're missing the budget that might ultimately be necessary to rethink about this and say, rather than peanut butter spreading across a lot of organizations, let's step back and think about our AI strategy.
One of the things that we really have to think about this is that it is a larger effort than most people realize, and you got to commit to that, right? If you're lucky and you can get through chapters of the book as you're making this transformation quicker, great. That's gravy. I think that's amazing. But most of the time, you still have to be comprehensive and structured as you go through it, and you got to do it all. It's not a piecemeal solution. Most of the time, you get in real big trouble if you just try to solve little parts of it and keep going. Um, I so I had a friend who was literally a rocket scientist for NASA, and was like building, helping back when we flew the space shuttles all the time. And you can imagine there's like 100,000 checklist points of things to work through, right? But what they didn't do is go, oh, we think there might be something wrong with this little part of the booster, and just go fix that and think that everything else is going to be fine. Because they realize you can't just do that and without thinking about how they'd have to actually restart through the entire thing again to make sure, because the risk was too high, right? And in my mind, the risk is too high for an organization in RCM to not be comprehensive about what you're going to do. If you think you're going to be able to just solve it by little patches and fixes here and there, that will come apart. Like, you might get away with it once, maybe twice. I'm just going to tell you, by third and fourth time, you're really risking the space shuttle. It's going to crash, right? And so this is kind of just being able to commit to that and understand that that is the nature of what I call enterprise world class RCM work. It's got to just be brought up and elevated to that level.
So again, if I then try to summarize some of the points that we've talked about here, it's really to think about RCM in that more connected ecosystem way. It's not a series of point solutions that sum total to an outcome. It's really redefining what revenue cycle is, thinking about it as data shift left. We've long talked about that. AI presents the opportunity to really meaningfully shift left, create a data context layer that then we can drive outcomes associated with.
Yeah, look, I think those are all the things. And then, think of them not as just the people who are going to get you a check back, but you really have to think about them as being the gatekeepers of your data, your information. And that really is the gold mine and the value that you're creating as you go through this. This will drive strategy, this will drive forecasting, this drives all the things that can make an organization amazing down the road. And and so I like to think of RCM as not just about making sure we get paid, but it is about making sure we are valuable, right? And so that is about making sure that data is good.
It's fantastic. And then it's in order to achieve that, it's sponsoring this kind of, hot take thinking at the right level in the organization. You won't get there through a set of departmental budgets that you ask to go solve AI. It takes
Yeah.
sponsorship at the right level.
Well, and look, I think AI. So I love it. I'm deep into the pool. I'm all pro AI in every way, but AI can be dangerous because it is not a solution in of itself, right? What it does is it leverages the people that are using it, and so you still have to invest in the people. You still have to develop them. You still have to make sure that whatever solution you have is human driven, human managed, but AI can make them superheroes, and you can take an average person and make them really effective and great, and you can leverage them a lot more when you do this. You can take a great person and make them just fantastically amazing, right? So those, make sure as we go through this, like, don't lose sight that what makes it really work is your people, but what makes the people work great is going to be the system.
Fantastic. And then really it's and somewhat tied to your answer there is it's winning on the 10%, not on the 90, right? It's to get
Yeah.
people operating at the top of their capability, where the AI and maybe the amount of information that's being assimilated, AI can even offer some information to those humans in the loop, but it's freeing them up to really focus on those high value, high dollar, complex cases where they can operate at sort of the top of their license.
Yeah, I don't know about you, but your experience, but my experience has always been that eventually I end up in some pile where there's a bunch of this 10% that didn't get resolved over the course of 3 months or 6 months, and then we got to have like a big kumbaya, let's get together and have our wrestling cage match and figure out how we're going to deal with these last sheet of claims and what has to happen, and am I resubmitting these? Are we settling those? Am I giving up on them? Like, and I'm like, let's be better prepared for all of that conversation. One, let's just try to figure out less of those on the list. But two, when we do have to go have those conversations, let's be ultimately prepared with all the things. I can't tell you how many times we go, well, okay, we're going to have 3 meetings just to define the list. And then we're going to have meetings to define which of the lists we're going to talk about next. And then, we eventually get, and then we're like, oh shoot, there's a bunch of these. Well, okay, we think you think we owe you, 2, and you think you owe us 5, and we're going to go at 3.5, right? Like, we got to be better at this, and we can be more prepared for it.
It's interesting as I sort of reflect on everything we've spoke about here, Jeff. Sort of history repeats itself. It's just the new technology that sort of creates the new buzz and opportunity to be more meaningfully leaps ahead. But at the end of the day, what you and I have really just talked about is it comes down to people, process, and technology. And
Yeah.
at the end of the day, AI is an exciting opportunity, but it's still going to come down to those people, process, technology, and how, with this new powerful tooling, we can use it most effectively across those three pillars.
I will say this though. I do think you have to commit to having it. You got to commit to having it now because otherwise you're going to a gunfight with a knife, right? And so that is the way of the world now because the other side is they're armed, they're ready to go. They've invested all the effort and resources and time into creating their side of the deal. You got to be able to bring your side too. So this is one of those things. Like this isn't so much a maybe we do this or if we do this. This is no, you're going to have to do it. I think it's just about how well do you do it, how smart do you do it, but you got to commit.
That's fantastic. Well, Jeff, I think we've given our audience a lot to think about here. I think sponsoring AI initiatives at the right level, really getting people to operate at the top of their license so that we can ultimately focus on those highest dollar, highest value opportunities to improve our RCM metrics. Any closing commentary that we should share with our audience? We've had a great interactive conversation here this afternoon.
Other than this, like I'm sure there are 1,000 more points and things to think through and do whatever. Because if you've done it once, you've done it once, and you get, the next mountain is totally different. But what I would say is you build that capability about how to get through it, how to define your processes end to end, how to get everybody aligned, how to work through it, use the data, use the system to give you feedback as you're doing it, improve your cycle time as you're thinking about improving. That at the end of the day is kind of going to be the game. And I wish everybody the best of luck as they go through it because everybody gets to go through it. That's the way our system works. But there's light at the end of the tunnel. It can be done well. I've seen it done well, and just keep grinding at it.
Appreciate the insight there, Jeff. Certainly, Innovaccer stands ready to help our customers through those transitions. AI is not something you really should go alone. You should find that vendor that can help you across all of these different spheres of influence, and certainly Innovaccer stands ready to help our customers. So, on behalf of Jeff Spight, thanks for joining me today. I'm Patrick Leonpacher, SVP of Product at Innovaccer for our RCM division. Appreciate everybody's time this afternoon.